Welcome to year 5 of SPREAD. I can't believe we made it to year 5. SPREAD stands for Supporting Peer Respect, Education, and Discourse. And our mission is to create community where folks can connect with each other on multiple levels of life by pursuing and sharing their interests. So whether that's learning a new skill, whether that's bartending, skincare, or brewing coffee, or whether that's a new knowledge. You're learning how to buy a house, or financial management, or public policy. Or if you want to pursue a certain experience, like volunteering at a food bank or volunteering at a marathon, we want to provide a space for friends to share their interests. So thank you all for coming to our first event of the year on a Saturday afternoon and being part of our community. So today Stephen will be talking us through the March 2024 election, and without further ado, Stephen.
Yay! Okay, so 2024 is an extremely busy year. Politically, there's going to be 2 elections, a ton of almost all the offices you can think of, up to the president. But today we're going to be talking about the ballot that you're going to get in a week or so. And we're not going to be talking about any of the offices because there's a lot to talk about, but today we'll be focusing on 6 different propositions, and it's going to be very, very hands-on. So we're going to shoot for about 30 minutes for each of those questions. And so I'm going to give a little background on each of those, and then we're going to split up into groups to research, right? So we're splitting into 2 groups. You're going to be researching the for part of it or the against part of it. We're going to get back together, you're going to present to each other, and then we're just going to mix it up for 10 minutes before we move on to the next proposition. Okay? When you're listening to the presentation, or when you're researching these questions, think about, what are my immediate reactions to what's being proposed? What do I think I need to know in order to make a decision? Okay? And the idea, of course, is just to leverage everyone's perspective and experience and tackle these questions together. So everyone's going to be editing these slides together. That's how it's going to go. We can shoot out the link again, or you can QR code this. So we'll come back to the screen when we break it off again. Okay. Yeah. So again, we're doing 6 of these, so we're going to try to be quick about it and move. And I'll keep everybody on time. Okay. First, this is the only state proposition, and this was brought forward. This was the governor's big push, right? He wants to do something big on mental health and homelessness because we all know that's affecting our quality of life, especially here in San Francisco. So just a little bit of background. The homeless population in the state is 180,000 and growing. This is like the largest share of the national population, so we all know this. And there was a survey, and I linked it, you can click onto this later. They did a survey and they found that apparently of their sample, 27% of homeless had been hospitalized for a mental health problem sometime in their life. And if you extrapolate that to the larger population, that's 48,000 people, which is pretty insane. Continue down, right? 23% experience impaired hallucinations. A third of these folks, apparently, the people who answered the survey, did drugs three or more times per week. Okay. History of what we're talking about. In 2004, voters passed a Mental Health Services Act. It taxes income over $1 million, and that money is used to treat mental health issues. Okay, the money goes to the counties, and the counties produce 3-year plans every 3 years that say we're going to spend our share of the money on such and such. Most of the money is used on community services and support, and also prevention and intervention. Not a lot of time to get into these, but we're going to move on. Okay, so California has a total of 14.5 thousand beds, acute psychiatric beds, subacute. I don't actually know exactly what those means, but this just gives you an idea of what at least one study has told us we have.
Acute and subacute, like if they're critical care or non-critical care.
Is acute critical care and subacute is not critical care?
Yeah. So like think of hospitalized versus like long-term stay versus short-term stay and things like that. That's what it means.
And then that same study estimated that we need at least 2,000 more acute beds and 2.8 thousand more subacute beds and 3,000 more community residential beds. Okay, so idea being that, as we already know, there's not enough beds and there's not a wait list. Okay, so what this proposition does is, first thing it does is lets the state borrow 6.3 billion more dollars in order to treat mental health and substance abuse. 4.4 billion of that will be for that purpose. 2 billion of that will be for housing facilities. And apparently, it's going to build enough space for 11,000 beds. This is just to keep in mind, sense of scale. The California budget is $310 billion. It'll create 6,800 beds for mental illness addiction, 4,300 beds for mental health and addiction services, reserving 60% for veterans. This proposition will also allow funding to be used on substance abuse, whereas before it was only for mental health. So there's that distinction there. It also changes how current programs are funded. So that the money that's currently flowing from the millionaire's tax, it's going to change how that's funded. So that's one source of like friction, where people are already having a program, they're already doing their own thing. This changes how the money is going to be spent. It also changes what's required. Like, so when they get the money, the counties have to spend 30% of that funding on housing. Before, they didn't have to spend any on housing, like building places for people to sleep. That's via rental subsidies or construction. And then finally, funding can be used to treat individuals against their will. So this is a big, sticky point, because I think in the actual language it says that the facilities that they're going to be building with this money, they can be locked, like, you can be locked in there. So that's the detail that some people have a lot of issues with, right? Okay, and then finally, it shifts the money, a good portion of the money that counties get, to state control as opposed to county control. So, some people might not like this because, it's the state and the governor, trying to, be stronger on this and telling them what to do with the money. So that's kind of the source of some of these anxieties, especially from nonprofits and providers, right? So the whole idea is they're trying to change the funding to address the homelessness crisis, whereas some people say, oh, the money's better spent preventing and intervening early before they get on the street. So this kind of shifts that money in that direction. Okay, so that is the background for this one. Let's go back to this so everybody can get on the slides. Two groups, for and against. Okay, one.
Two.
1, 2. 1, 2. 1, 2. 1, 2. Okay. You guys just stood up, right? That's right. Make some new friends. It's all good. We're going to do this for about 10 minutes. Okay. So there is a slide for each of these, right? Fill it in why you think people should vote for this. And of course, it's okay if you don't agree with the side that you're on. That's kind of the fun part. And then the other folks build this slide, and then we're going to present to each other. Technology.
With the incomplete
Oh,
one.
there it is. Magic. Okay. All right. Somebody, or you guys can just talk through it, or somebody. Volunteer
I
tribute.
think Annie wants to.
Who's Annie?
Who's Annie?
Not well,
So Prop 1, it helps homeless people. I think we have a very large unhoused population, and they need more support. So, this is kind of a different angle of tackling the homelessness problem, since previous solutions have not worked well enough. This will more so than just this proposition directly addresses the root problem of homelessness, which is like not having a roof on your head, right? That's like that's the root issue. Because if you give people like job programs or teaching, whatever, then it's like they still need like a base of operations. You still need an address if you're going to try to apply for a job. You need an address if you're going to get a lot of different benefits are tied to a specific location or address, right? So this would give people, or help to give people, a roof over their heads. And also the whole thing about like forced whatever. Well, some people, they need a forced intervention for, treatment for addiction and stuff. And it's very hard for people who have that addiction to voluntarily be like, yes, put me through this excruciating process of, drug treatment and stuff. It's like, well, some people need that stern hand. Statewide funding, some of the funding gets shifted from the county-wide to the statewide, and that's great because it makes it more flexible, because the state would be able to redirect funding to problem counties in more specific areas, and it's more efficient that way because it's consolidated. And annual audits are required. So if you're a little bit worried about where did the money go, well, there it is. It's audited. Because currently, I don't know if it is audited. Is it? I don't know. And also, you know, something's better than nothing. Like, this doesn't necessarily address the entire problem, but 6,000 beds, but like 6,000 more beds than what we have right now is better than 0 beds more than what we have now, right? So I don't think it completely solves the problem. I don't think anybody is arguing that it completely solves the problem, but you know, something's better than nothing, and it doesn't create new taxes. I don't believe it just redirects funding. So if you're worried about getting hit on your bill, don't worry about it because it just does it not do that? I don't know.
It is more debt that the state is taking on.
Yeah, it's the state taking on the debt, and the state is taking on the responsibility.
Hold on.
But they get to say where the money. So it's like, you know, it's fine. It's not you, the taxpayer, that's taking on.
Well, the taxpayers eventually have to pay back the
Yeah,
Oh,
we gotta pay.
You can have Prop 2 for that. I don't know.
Minor details. Minor details.
Okay, 30 seconds. Foresight, anything to add? All right.
Dan, sounds like I
Against.
Great.
Against, what you got? Against, go ahead.
Claudia?
Whoa. So much.
Oh,
Okay.
hurry. Okay. So I guess there's some studies have shown that forced treatment is ineffective and actually like increases the rate of like people committing suicide or just
Oh my
like
God.
going back to like whatever they're doing before the treatment as well. The money that we're gonna put into the program like doesn't just come from nothing either. Like 1/3 of this money is going to be coming from like existing funds from Mental Health Service Act, and that Mental Health Service Act has already been proven to be pretty effective, like with handling mental health services too. So it kind of take money away and be kind of programs if we have this, if this like proposition is like passed. It's very expensive. It costs like $10 billion. Some of this money is coming from bonds that you'll have to pay back as well. I don't know if I missed anything. Did you want to cover the rest of it? I think that I covered bonds.
We've already thrown a lot of money at the problem, $20 billion, in the last 5 years without making significant progress. The number of unhoused people has increased over the years, not decreased. So clearly something's not working. We'll have more tents in the sidewalks and fewer people in treatment if Prop 1 passes. Also, now if Prop 1 passes, there's going to be more state control. So local cities won't have as much control with the money and how to direct the services. Anything else?